Hello again. Now we're going to talk about healthcare. I'm going to give you what I believe is the best healthcare plan I've heard. And so right now, the state of Iowa is contracted with 3 different HMOs, or insurance companies. And one of them is Molina, one of them is Amerigroup, and the other one is Iowa Total Care. Now, Iowans who qualify for Medicare or Medicaid are required, right now we're in a choice period, we have to choose which one of those we want to cover all of our needs. And what I would like to change is I would like to create an HMO conglomerate. Now what that means is that it would be several insurance companies working together, but instead of one company covering everything, like for example, Iowa Total Care might just cover nervous system, muscular, skeletal, including dental. Amerigroup might just cover endocrine, did I say respiratory? We split it between the different HMOs. Now, what that's going to do is that's going to make it so the HMO is going to save a lot of money. Like, I don't have to cover 75% of what I was covering. So I don't have, but now I can invest a lot of those resources to make sure when we are covering something, Iowans are getting way more coverage. Medications coming down in price. We're going to be able to offer more competitive prices to surgeons. I talked to a surgeon and I said he didn't want to contract with any of the HMOs, and I said why? And he says they don't offer competitive rates. So that's another thing we're going to be able to do. We're going to be able to contract with more surgeons and get top-notch surgeons into this. Now, I'll be honest, I liked Bernie Sanders' plan with single-payer health care, but the reason it didn't go through is like his idea threw the insurance companies under the bus. He made a lot of enemies out of them, and I don't think that was intentional, but what I like about this idea is that it includes the insurance companies and says, you've got the expertise, you've got the staff, we're going to put you in the position to save the our Medicare system in a way that's replicable, that if we model it here in Iowa, which I think we can, then other states can start replicating what we've done. And now that we've got those 3 HMOs contracted together as a conglomerate, all Iowans are getting better coverage. We can do things like offer paid maternity leave for the first 2 pregnancies. We could offer a week of paternity leave because bonding with a child, especially just after they're born, is extremely important for fathers as well. And by switching up the way that we're managing it, I think we just kind of, sorry for all you 80s kids, we just need to Voltron the insurance companies together, and once they're contracted together, then we can start inviting other insurance companies who are headquartered in Iowa and tell them, join the conglomerate. They're going to be first in line to join the conglomerate. We want to attract HMOs and say, you should headquarter in Iowa because you can get in on this contract. And once we've got that initial conglomerate forged of our HMOs, then we can leave it up to the conglomerate. Do we want to allow more HMOs from out of state? But let's leave that up to them, because we want to negotiate the best deal we can with these HMOs to get Iowans the best fully covered. Now, here's the other thing, small businesses. I keep hearing from small business owners, we can't afford to give our employees health insurance. One of the other beautiful parts of this is right now Medicaid is mostly for low-income people and elderly. But as we create the conglomerate, now we can offer an inexpensive health care plan to small businesses. Like a woman that lives down the hall from me in my apartment building, she said, I earn $3,000 too much per year, so I don't qualify for Medicaid. How does this help me? Well, if we allow small businesses to buy in and get this premium package so they can offer all their employees really good health care at low cost for small businesses, and we do this through the conglomerate, then now she's going to keep that money in her pocket every month. The insurance company's still getting paid, but now they're getting guaranteed income through tax dollars. Iowans are going to save money, and you're going to save more money from not having to get private insurance than you will lose through the taxes. So it's going to drop the cost for the average Iowan way down. And it's going to incentivize, if private insurance companies are like, oh no, we're going to lose customers. Dude, get in the conglomerate. It's guaranteed income. This is how we save Iowa's healthcare system and greatly improve it. Help everybody, just get everything fully covered. Come on, we're in the future. Let's get a little bit more Star Trek up in here. Thanks.